Welcome. My name is Clark Korb. I'm a holistic health practitioner, and today I will be exploring a question that I've received many times over the years in my private practice. What do you think of XYZ therapy? Some therapy, whatever it is. And I'm going to offer several criteria to consider when seeking your match for a particular therapy and therapist or a practitioner. This is specifically relating to the health and wellness field, but I'm also going to offer aspects which are applicable to many other industries, any professional service that you're seeking. And as a bonus, I'm going to provide some recommendations for the professionals on their end of it, how they can build a stronger practice with clients that they really like working with. So first and foremost, this video is not intended to diagnose, treat, cure, or prevent any illness or condition. And if you need emergent medical help, please dial 911 or go to the emergency room. We're not going to cover those type of emergent situations. What I'm offering here is only some guidelines to help you find the most effective therapies and practitioners for your particular challenges and interests. Okay, with that out of the way, what are the criteria that I believe are most important in finding a good match? First is really understanding the challenge or the symptom that you're addressing. Second, the modality or the type of therapy that you're considering to treat that challenge or work with that challenge. Third, evaluating the practitioner. And then also really having a clear idea of your individual preferences relative to the therapy. And last but not least, the timeliness or time appropriateness of finding a particular modality with a given challenge that you're working with. So first off, dealing with a particular challenge or symptom. If you go into your doctor's office, if you're under an HMO plan, you often require a primary care provider as being the gatekeeper to provide the initial direction of what treatment plan you follow. And even if you're insured under a PPO plan where you can walk into your own specialist of choice, the specialist that you see may or may not be aware of some treatments outside the focus of their relatively narrow and specialized training in medical school. And so with this, it can be really hard to find the right point guard. Who can you consult as being your Sherpa, if you will, in the health and wellness realm, again, for non-emergent situations. So it can be difficult to rely on WebMD to tell us all we need about seeking a particular therapy for a particular challenge or symptom. And chronic issues can be a lot harder to suss out. And I believe it's of primary importance to be your own advocate in this. Seek referrals from those who've had similar challenges, and reading and studying from multiple sources of well-qualified opinions, either people that have been educated or ideally have experience in helping people with specific challenges that are similar to yours. Okay, so once you find a modality or a few modalities that seem like they might be applicable for the particular challenge you're working with, it's important to recognize that all modalities have a scope of practice that is appropriate for their specialization. In other words, I wouldn't consult a plumber for tax advice usually. That doesn't mean that a plumber couldn't have great tax advice, but that's not their area of specialization. Most likely they could provide a referral to someone who helped them in providing solid tax advice. The same thing here applies to health and wellness. In general, holistic care is not for emergent situations, i.e. Anytime you would need to go to the emergency room or you have a life and death situation. And in the same fashion, emergent care isn't typically suitable for chronic or overall wellness and preventive measures. And in many cases, unfortunately, the holistic health realm can tend to offer solutions that are presented almost as a panacea, and I would avoid those. I've been a holistic health practitioner for 20 years now, and I've found it most beneficial to be really clear on what I can provide that's within my scope of practice and that I have a high level of probability of being able to help some with, and being clear on everything else that I cannot help with. And so one place where this can get kind of tough to determine, and the reason why finding a matching modality might be kind of tricky, is that there are both overlapping and non-overlapping benefits of therapies. So just to pick a concrete example here, let's talk about soft tissue mobility, since that's within my scope of practice. There are a lot of different modalities and activities that one can take part in that will help with soft tissue mobility. One is mobility training on your own, movement therapy, stretching, yoga, physical therapy, body work. That's certainly in my realm, and there's a gazillion different types of body work, hands-on manual therapy. There's acupuncture. All of these may offer a number of benefits in improving soft tissue mobility, but they do so in very different ways. And some may be more applicable for the given challenge a person has than another. In my experience, this is really a perfect example of where the whole is greater than the sum of the parts. In other words, multiple modalities may work best together, done in conjunction or in sequence, to provide a better result than you otherwise would have sticking with just one. A good example would be having some soft tissue work to break up adhesions, then having some physical therapy or movement therapy in a prescribed way that helps you really reinforce and retrain the nervous system to move in a more open way than might have been experienced in the past, and then adding in some anti-inflammatory nutritional support, for example. Okay, so then outside of the modality, once you find a modality or group of modalities that might be a good fit, evaluating the suitability of a practitioner within each of those modalities is important. So one, there's of course the general technical competency, being licensed, having education and training into the particular modality of their training. But on top of the technical aspects, the level of consciousness, the awareness, the presence that the practitioner has. This might in general be the bedside manner that is typically ascribed to doctors. Ultimately, what matters is that the practitioner earns your trust. And certainly personality and chemistry can be part of this. It's great if you do have kind of a nice rapport with someone. It isn't ultimately necessary, but they do need to earn your trust, that you believe that they are helping you with their greatest intention and their capabilities within their scope of practice. I also think one trait to look out for here that I would avoid is what I would lump under the category of scarcity-minded practitioners. So this can show up in a couple of different ways. Some people that have the know-it-all or kind of the God complex. If you can't be helped here, then no one can help you. I've heard this phrase a few times from other people that citing some other practitioners. And sometimes other practitioners might be overly prescriptive in terms of telling someone, well, make sure when you go see someone else, have them do X, Y, Z, or work on or look at X, Y, Z. I find this to be really inappropriate for a number of things. My general recommendation for people, if they're going to have multiple practitioners, is let the practitioner that you're working with do their genius work with what they know and can help you with within their scope of practice. Period. End of story. That doesn't mean that they aren't open to collaborating with other therapies. They should be, but they shouldn't tell other therapists how to do their job. I think that's pretty straightforward. Also be aware of the scarcity mindedness can come in the form of they may try to lock you into a particularly rigid framework or schedule, like you need to come in for X number of times a week for however long, that sort of thing. It's one thing to provide a recommendation based on their experience saying, well, you're likely going to need a few sessions to get you over the hump, this sort of thing. But to sort of lock in a rigid framework, there's this line that they cross where it seems like it's overly prescriptive in terms of what's necessary for your particular case. And it might be more about them trying to fill their calendar than trying to give you the best match for what you need when you need it. Just something to evaluate and look out for. I'm not saying everyone does that in bad faith, but something to consider. And then, so beyond finding a practitioner that is competent and a good fit for your modality, then there's your own individual preferences as a client. Just in general, personal likes or dislikes. It's fair to have an opinion on whether you like the location or the quality of the facility, if it's reasonably easy for you to get to or not. Again, personality match with the practitioner, not necessarily required, but it's great if you do have a decent rapport with the professional you're working with. And an overall experience which just feels comfortable. So similar to exercise, if you want to find a modality or modalities that you engage in, that you want to engage in with consistency. And a big piece of this also is a willingness to invest in yourself. When I have people that ask, does insurance cover what you do? In my case, it does not cover what I do. But folks can use a flex plan or health savings account to cover expenses related to the work that I do. And like anything else, ultimately this boils down to, if you're only going to consider health and wellness practices or modalities based on what insurance covers, you might want to consider the benefit to cost ratio, the ultimate value that you're getting from that. Is investing in your health and wellness more important than just what's the cheapest thing or what insurance can cover? And again, we're not talking about exorbitant fees that you would experience going into a hospital for emergent care. This is something that you would build into your budget based on what you value. Okay, so moving beyond that, then there's the time appropriateness. So some therapies are contraindicated for acute phases. For example, in post-operation rehab, you wouldn't want to have soft tissue work done when you're still healing from the result of surgery in general. You want to make sure you're cleared for manual therapy from your doctor before continuing with that. And beyond that, aside from that acute phase, there are often different times in life where a person is ready for different types of therapy at different stages of growth in their life. When you're in your early 20s, you may or may not be open to life coaching, for example. or you may be perfectly open to it. It really depends on your mental, emotional, physical state, your financial preparedness, the level of maturity that you're at emotionally, in your career, that sort of thing. And just recognize that there are different therapies, different matches at different times, and it's all okay. So now, considering that entire list of things and finding a match for you for the challenge in what you're working on to improve your wellness, I want to look at this from the practitioner or the professional's perspective. And so this doesn't apply just to professionals in the wellness industry, but really any industry. And in doing so, if you can look at this from a greater perspective, it can help you not only find better clients for you in a fuller practice and maintaining a happier practice or a happier business for yourself. So keep in mind, as a professional, the only aspect of the whole list that I ran through that you can control is your own relationship to your practice. You can't control any of those other subjective metrics for the client, for what they're seeking. So in other words, you can focus on your own technical competency. You can focus on your own level of consciousness, awareness, your people skills, and your belief in abundance. So to address some of these areas, it's important to engage in continual education. Certainly in your technical field, you want to be learning about your own work as well as adjacent fields. It's actually a tremendous benefit you can provide to your client base the more you know about a modality or a type of therapy that is outside of your scope of practice but might be super beneficial in place of, or at least in conjunction with, the work you do to help refer them out. And this is a big piece. Most of our professional fields require some sort of continual education for licensing and recertification, and it's just great to do for your own development. On top of the technical continuing education, of course, there's this personal development piece that I believe is super, super important. And with this, you can begin to clarify your own values relating to what you offer to the world above and beyond just your technical competence. What is it you want to bring to the world in a larger sense? What is it, your overall intention, the value that you're adding to the world with your practice? What kind of clients do you want to work with? What are their attitudes and belief about health and wellness? Their accountability, what kind of personalities you want to work with. Do you want to work with a practice where you can laugh and enjoy life and visiting with your clients, or do you want to have more of a rigid clinical type of environment? It's super important with this to be continually developing your own people skills. If this hasn't been an area that seems like it comes naturally for you, you can certainly practice. You can become a more active listener. Learning to be genuinely interested in other people, practicing empathy, really putting yourself mentally and emotionally in their place to be able to gain understanding about where they're coming from. Also practicing abundant thinking so that you avoid some of those traps that I spoke of earlier. Recognize that you don't have enough time to possibly help everyone, so stop trying to do so. And this can be really hard for a practitioner who's in startup mode and just beginning their practice and is concerned with trying to make their overhead. I've always thought it's super important not to chase clients or to want to be more concerned with filling my own calendar than helping someone get the kind of work they need at the appropriate schedule and timing for them. It's all about helping those individual people. And then over time, you have enough people you're working with where you can work as much as you want, hopefully. The other thing I believe is really important with this is being an advocate for your field and for other practitioners. With this, I would really encourage removing any negative talk or hypercritical talk about other therapies or individuals. It's fair to offer your experience, of course, to say that whether or not something was effective or not for you, but I think that's an important qualification, is that for you or for your circumstance or for clients that you know who've had this experience. If there's a modality that didn't provide the results that you would wanted, it's valid to note that, but also recognize that everyone usually provides some value for the right client, and maybe just you weren't a right match for that person or at that time, that modality, that sort of thing. Ultimately, there's different strokes for different folks, as the saying goes. And it's important just to focus, I believe, on what value you provide and let others kind of sort that matching out for themselves. What about this resonates with you? Let me know in the comments below. If you know of anyone who may benefit from what I've shared here, please forward this video to them. And also, if you found some value in what I've discussed today, I would certainly appreciate your giving this video a like, clicking on the subscribe button with notifications set to all to avoid missing future posts. These small actions only take a few moments to do. They cost nothing, and they really help support the growth of the channel. Thank you for tuning in.